All right, so for more now on this, we're joined via Skype by SABC News correspondent in the US, Sherwin Bryce-Pease. Sherwin, good afternoon to you. Thank you so much for coming through. So the US COVID-19 deaths now surpasses fatalities in the Vietnam War. Do you get the sense that people are not necessarily taking precautions?
No, I don't think that would be fair. I think there are people taking precautions, and I think those numbers speak to why they would do so. I mean, you know, in New York, the stay-at-home order or the lockdown restrictions in South Africa, people are allowed to go for exercise. You can walk your dog. But I was out just yesterday, and as much as you might see two people walking together, you know, holding hands, that's probably a couple that have left their homes together and are socially distancing themselves from other people. So it gets a bit confusing when you see some of the images of people, you know, in parks in the city of New York, the epicenter of the world, and the numbers so very high, Palesa. But let's speak about those almost 60,000 dead, the over 1 million infections. This really is a story of tragedy. These are families that are mourning loved ones. You know, when you see numbers on a piece of paper, or we have these conversations, they don't really resonate with families that perhaps haven't lost anybody. This is a story of tragedy. This is a story about gaps in how the world responded. Was there efficacy in the way the World Health Organization initially communicated based on the data they were receiving from China? What culpability does the White House have here in terms of its response, given what we're seeing in the media about various intelligence briefings, classified briefings provided to President Trump in the early months of this year, which were essentially ignored? So a lot of unanswered questions that we might have about the efficacy of the response. But let's not forget, and as those images, you know, the fly-past we saw in New York yesterday, first responders being celebrated by their colleagues in the New York Fire Department, it really is a testament of the will of these health responders, these first responders, these healthcare workers, but also a story of tragedy as many families are mourning today.
So as you say that this is a story of tragedy, also looking at how the economy has been doing in the United States, contracting by 4.8%, Sherwin, do you think this may be used perhaps by President Donald Trump to sort of push for America to open for business again? Is it likely to happen anytime soon?
Yeah, well, he's pretty much doing that, right? I mean, he has to walk this tightrope, Palesa, between the safety of citizens who don't want to reopen too fast based on their own federal guidelines. They talk about this phase 1, phase 2, phase 3 approach, but where states need to see a decline in hospitalizations, in the need for ventilator intubations, in the need for ICU beds, in the need in a drop in the death rate, you have to see a 2-week decline before states reopen. But you know, let's think about the United States as a quilt. A quilt is made up of different pieces of cloth stitched together. But each cloth is different, and so too the states are very different here. In New York State, for example, the governor is talking about reopening in a phased approach starting on May 15th. Construction workers, people that are working in forestry, non-essential workers, where the risk is going to be very low in terms of social distancing and that sort of thing. Whereas Colorado, for example, across the country, sort of closer to the West Coast, there you have now what's called a safer at home phase. 30 days where retail businesses will be allowed to reopen, but that's not for the entire state. If you look at the city of Denver, which is the big city in the state of Colorado, they are continuing to be under a more stringent stay-at-home order. So you even see the disparity within states. Northern New York, some of the upstate areas of New York are not experiencing the volumes of coronavirus infections as we are in New York City and the surrounding suburbs. So even as states begin to reopen under pressure from President Trump, given that this is an election year, they are having to calibrate their reopening based on the data they are seeing from county to county, from district to district. And so there's no unison approach here. There's no universal approach here. It's going to be a wait and see approach based on the specific data in specific areas. So certainly from the epicenter point of view here in New York City, we have a long way to go in terms of reopening.
Yeah, so let's just talk about vaccine testing, Sherwin, that's set to begin next week. Talk to us more about that.
Yeah, some good news in terms of vaccines, Palesa. We are getting reports that vaccines, a German company working with the U.S. pharmaceutical company Pfizer, has begun human trials and could supply millions of these tests on an emergency basis by the autumn months in the United States. So essentially, when you're heading into spring in South Africa, in the southern hemisphere, we could begin to see some vaccines available on a emergency basis. But that does not mean the trials, the human trials that take between 12 months and 18 months will not be ongoing. This is on an emergency basis. That's the Pfizer one. Oxford University has also revealed some promising indications. They've reported that they're ahead of the pack in terms of certainly the tens or dozens of companies, multiple dozens around the world that are working on vaccines from Asia to these United States. Oxford scientists say they're hopeful that they could have a vaccine available by September. Apparently, this is a laboratory at Oxford University that has done some work on vaccine-related research in the past, and they've used those models to inform how they approach the COVID-19 response. So Oxford University, Pfizer, and remember there are multiple vaccine trials underway around the world. Bill Gates, the Bill and Melinda Gates Foundation, is funding a number of vaccine trials, but that's only the beginning. Distribution becomes a big factor as well. And we're also seeing reports, Palesa, out of India that a pharmaceutical company there will start producing the Oxford vaccine, the trial vaccine that's underway at Oxford University, even before the vaccine trial is complete. So you can get a sense here, based on the economic data that we're sharing with you today, the urgency that is required here. How do you open up, fundamentally, how do you open up economies safely? The only way to really do that is if you have a vaccine. Otherwise, these social distancing measures will have to go on for a very long time. The vaccine will be the ultimate protector for economies returning to some sense of normality.
All right, Sherwin, time constraints, we'll leave it at that. Thank you so much for that update. Our U.S. correspondent, Sherwin Bryce-Pease, there talking to us about the state of affairs when it comes to the COVID-19 in the United States. As he says, this is a story of tragedy in that country.